All right, let's go ahead and begin. Good afternoon, everyone, or good morning, depending on where you are. Welcome to today's Flash webinar. Thank you for joining us. My name is Reem Tariq, and I'm a Senior Project Coordinator at the National Environmental Health Association. I also serve as the Private Water Network Administrator. Today's Flash webinar is brought to you by the Private Water Network. And the Private Water Network is celebrating its 3-year anniversary. To celebrate the 3-year anniversary and also to celebrate the National Groundwater Awareness Week, the network is hosting a series of events, of which this webinar is a part of. For those of you who are not aware of the Private Water Network or not familiar with who we are and what we do, I just wanted to put a quick note out there that the Private Water Network is a community of professionals and specialists working to protect the public's health from contaminants in private drinking water sources. The mission of the Private Water Network is to build a sustainable community for those working to support private water programs, to connect with their peers, to share experiences, insights, and resources, and to gain access to timely and relevant guidance for existing and emerging issues in private water. We also help to build capacity to do the work more effectively and efficiently in order to protect the public's health from contaminants in private water sources. To access the portal, you can log into pwn.neha.org. With that, let's get into today's webinar. The title of today's webinar is New Hampshire's Well Water Dashboard and Ongoing User Testing and Community Outreach. Our speaker today is Sam Harris. Sam is an environmental data analyst with the New Hampshire Environmental Public Health Tracking Program. The NHEP HT, which is the tracking program, is part of the national tracking network that brings together health data from national, state, and city sources and provides supporting information to make the data easier to understand. Sam has completed his master's in public health with an additional graduate certificate in data analytics from the University of New Hampshire. His current projects of interest include private well water quality and childhood lead exposure. Sam has been with the New Hampshire Environmental Public Health Tracking Program since 2020. Before I turn it over to Sam, I just wanted to cover a few housekeeping items. Please note that this webinar is being recorded. The webinar recording will be uploaded onto the Private Water Network resource library. We'll also be taking questions towards the end of the presentation. So if you have any questions throughout when Sam is presenting, go ahead and drop your questions in the Q&A box and we'll cover those towards the end. At the conclusion of the webinar, I'll share a webinar survey as well as our annual evaluation survey so we can get some feedback on the events that we're hosting and Private Water Network in general. And with that, Sam, I'll turn it over to you.
Okay, well, thank you so much, Tariq, for reaching out to me and being here today. It's really an honor. So I guess, Tariq, I'll be asking you to advance the slides, and I hope everyone can see this. We can see it? Excellent. Okay, so if we could go back just to the beginning slide, please, Tariq. All right, well, welcome everyone. This will be a very quick kind of presentation. I realize this is kind of a flash meeting, if you will, or a flash talk, so it won't be long, but I think we'll really get to the nuts and bolts of this project. So again, thank you so much for being here today. My name is Sam Harris. I'm an environmental data analyst with the Environmental Public Health Tracking Program through the great state of New Hampshire. And I'm here to share with you our New Hampshire Private Well Water Dashboard. And it's a new product that just started in January of 2022. I guess it's a year now. Time is going by quickly. And we're really excited about how this tool is being used in the state for kind of outreach projects with our well water community. So again, I am just a member of the team that was really able to bring this dashboard to fruition. It's very much a collaborative project, and we work very closely with our Department of Environmental Services team, specifically our Drinking Water and Groundwater Bureau. Certainly my colleagues in the Environmental Public Health Tracking Program are very key to the success of this project, as well as our team within the Health Statistics Data Management team, and of course the Public Health Laboratory. So it's certainly a collaborative project across multiple departments and even agencies within the state of New Hampshire to bring this to fruition. Next slide, please. So just a little bit about the funding of this project. So again, I'm an analyst with the Environmental Public Health Tracking Program. We are funded from a federal grant through the Environmental Public Health Tracking Grant. And this project was actually initiated from our colleagues within the Department of Environmental Services through a CDC Environmental Health Capacity Grant. Again, the grant was really to provide or promote creative and innovative ways to work across agencies to increase technical capacity and ultimately improve environmental improve environmental health awareness across agencies. And our goals within our grant is really to connect communities, public health professionals, policymakers, state agencies, and others to the data they need. And so this instantly was a great fit for collaboration. We were excited to join our colleagues to work on this project. Next slide. All right, so just a little bit of background or outline of this talk. So I will be talking about why private wells are such an interest in the state of New Hampshire. I'll be talking about methods, the technical methods of bringing this project to fruition. We'll be talking about training and user testing of this dashboard once it was completed. And we will certainly be talking about community outreach, how the dashboard is being used currently to improve environmental health through the state of New Hampshire. We'll be talking about findings and outcomes, how this database is being used for target outreach, learning from community water testing events, and we'll conclude with just some successes and take-home messages at the end. All right, next slide, please. All right, so a little bit about why for New Hampshire, well water quality is of particular interest. Of course, well water quality across the nation is of important interest, but in New Hampshire, we have a very large population or proportion of our population on private wells. So it's estimated that over 40% of New Hampshire homes use private wells for drinking water. And as with other states and across the nation, all well owners are responsible for testing and treating their drinking water. There's no state or federal regulation on these private wells. So private well owners are completely responsible for maintenance as well as regular testing of their private wells. Now, we do know in New England, due to our unique geology, that many wells have naturally occurring contaminants that exceed health limits established for public water systems. So on the left, you can see a study done by our colleagues for the U.S. Geological Survey, and they were looking at source water from community water systems prior to being treated. And sure enough, they did find that there are sources of contamination. This is specifically for arsenic here. Additionally, in New Hampshire, there are higher rates of specific cancers, specifically bladder cancer, that are higher than standard than the national rates of specifically bladder cancer in kind of the New England area. And there's studies that show that it's almost or can exceed a 20% higher than US overall kind of standard national rates for bladder cancer. Additionally, studies are now showing associations between the presence of arsenic specifically in water and those kind of elevated rates specifically of bladder cancer. Next slide, please. All right, so what is the issue? So for many years prior to me coming along, or prior to my tenure with the state, there's been an interest to share the the well water quality data that the state had collected over the years. These were collected primarily in two databases within the state. One on the on the Department of Environmental Services side, the Environmental Monitoring Database, and the other source is within the New Hampshire Public Health Laboratory side, within our Water Analysis Lab. So these were the two areas where this data was collected over the years and maintained. However, the well water quality data was stored in completely two different databases. The data was not publicly accessible, so it could be accessed through some sort of data request. But once you receive the data, it was not summarized or visualized through graphs, charts, or maps or anything of that nature. And it had to be cleaned and prepped in order to gain any insight into the data. So the data was there, it just really was not accessible. And so that's where this grant really fit a perfect need for the state. Next slide, please. So this is where we partnered again with our colleagues within the Department of Environmental Services to really identify those data sets that would be a great fit for this project. And we did identify those two data sets that I referenced previously. And once we identified them, we had to then clean the data in order to make them work together, in order to join them together, and to make them, combined for a visualization opportunity, if you will. And then once they were cleaned and prepped, we were able to visualize them and then worked with our development team to bring them to the web portal where they currently are hosted. So in terms of when all said and done, we were able to identify over 15 years of data. So it's 2006 to 2020. The study location was the entire state of New Hampshire. And we had over 24,000 unique wells. And we were working here with 14 unique natural contaminants for this particular dashboard. Just a couple of kind of technical background pieces. So a lot of efforts were put in to deduplicate unique wells between both data sets, as well as whenever there was a well that was tested multiple times, we would take the highest sample in order to really kind of identify those unique wells within the databases. And for those of you who are interested in kind of the technical tools that were used, once we had the data to combine them and to clean them, we used R as our data wrangling tool, if you will, and then Tableau is what we ended up using for our data visualization tool. All right, next slide. All right, and this is the ultimate product, which was a Tableau-based dashboard that is accessible through our data portal currently. If you have your cell phone, you're welcome to scan the QR code. Hopefully that will work. I tested it before and it did work. And if that is a little too cumbersome or you don't have your cell phone, you certainly can go ahead and link directly to the data portal. I did put it in the chat, and can someone see it in the chat? And Nicole, do you see that in the chat at the top?
I do see it in the chat.
Okay, great. So those of you, you're welcome to also click on the link in the chat as well, and that will bring you directly to our data portal, and specifically to our drinking water data portal. And again, you may need to go ahead and select topic as drinking water, and then the subtopic would be private well water quality dashboard would be the subtopic. And so if you're on your phone or you're following along, this is what you'll see. This is the primary well water quality dashboard that brings these data sets together and puts them in a tool that for the first time is easily and readily accessible for a broad range of uses. So you can see on the left, we have the towns of New Hampshire broken down here. And you can see that on the right, we have our analytes that were used, natural analytes, naturally occurring analytes as part of this particular project. So up on the right, we have the ability to select geographies either at the town level or at the county level. Again, these are aggregated at that town or county level. Anything less than 20 at the town level were suppressed. So they had to have at least 20 samples during that time frame in order to be available on this through this portal. Below the geography option, the user has the ability to look at 6 different measures in terms of measures of those analytes. So number of wells exceeding health limit, or excuse me, percent of wells exceeding health limit, number of wells exceeding health limit, number of wells tested, median concentration, maximum concentration, and 95th percent value. Below this, you can see the 14 analytes. It's really 12 because we have flush and stagnant for both copper and lead, but 14 different options to choose from, if you will. So there's arsenic, chloride, copper, flushed and stagnant, fluoride, iron, lead, flushed and stagnant, manganese, nitrate, radon, sodium, and you can't see it here, but uranium as well. So the user has the ability to select any one of those 14 options. Now, up on the upper left up here on the portal, the user has the ability to download these as PDFs. For example, if you wanted to import them into a presentation of some sort, the user could do that as well. And then instead of a lengthy data request of old, the user can now download the entire data set for further research directly through this link at the top as a CSV or Excel file. And then also in terms of additional kind of data or background information about the methods and sources of data can be accessed through this eye icon. So think of it as a metadata kind of access point at that point. All right, so in addition also to this primary dashboard, for those of you who are perhaps on the portal through your phone or through our data portal website, we also had actually four additional supplemental dashboards to give us a better idea of kind of the more complete picture of this kind of well water quality historic data held by New Hampshire. So in addition to this primary source, we also had a town summary dashboard, which allows the user to select a specific town. It will give the summary of those analytes at the town level, and you can then compare those results at the county and state level to give a comparison of the town level, if you will, to the broader geographies. Additionally, there's been there's a lot of interest in arsenic contamination, specifically in New Hampshire due to our unique geology. So there's been some excellent research done by our colleagues at the USGS, US Geological Survey, and they've done some probability work around arsenic. And so we're able to map that as well. And that really helps with identifying those areas of the states perhaps that don't have testing in this particular data set. But those probability mappings can really help us kind of identify those areas that potentially have higher probability, but just haven't been tested as of yet. Additionally, we were looking at estimated populations served by wells, as well as testing behavior. And so we created two additional dashboards as well to look into that data. And we use BRFIS data, behavioral risk factor surveillance survey data, in order to look at that data. And so the user has the ability at the county level for populations served by wells to look at that data, as well as testing behavior, perhaps, or for example, when was the last time the user tested their well water, as well as how frequently they test that well water. So that's very of interest as well. All right. Oh, and you also notice here that, so these are natural contaminants that were chosen for this dashboard. So PFAS, for example, is of interest, I guess, nationally or internationally, but specifically for the southern part of New Hampshire currently. And that's being handled directly through our Department of Environmental Services. So they're working specifically with the PFAS contamination. But so again, this is really a naturally occurring contamination or contaminant dashboard, if you will. All right, next slide. All right, so just a couple more pieces here. So in addition to the actual dashboard, we also really spent a lot of time, and I suggest this for all projects, on training and user testing. So once we had a working and functioning product, we really wanted to get some additional details or feedback from our technical colleagues. So we identified some key partners within the agency, within our department, as well as through the Department of Environmental Services to get technical feedback. So we identified those partners. We developed 90-minute training sessions and then executed those training sessions with 3 different groups to collect feedback for future versions. So this is really version 1.0 that you're looking at. We're actually working on version 2.0 currently. And we were able to create this great kind of priority grid of updates for version 2.0 based on basically effort and value, if you will. And we were able to share that back to our colleagues. It was a great way to close that feedback loop as well. So I highly recommend a rigorous training and user testing component to a project. Next slide, please. So just in terms of community outreach, so immediately, even as we were doing this project and people heard about that we were bringing these data sets together, people were reaching out to us for community outreach projects. Almost immediately, our colleagues in the Drinking Water Bureau were contacting us to see if they could use the data to identify communities that may benefit from targeted well water quality outreach programs. And so this is just an example. Currently this was a project that was done immediately where 3 different communities were targeted for outreach, specifically because of their historic higher rates of arsenic and uranium that we could easily now see through the Tableau-based visualization. Go ahead and next slide, please. So just findings and outcomes from this. So user testing, great. We were able to gather and consolidate a tremendous amount of feedback from great technical resources and created a great work plan for version 2.0. Community outreach, we were really interested in those surveys. What did people do once they had this targeted outreach kind of intervention, if you will, in their community? And we received some positive feedback that 17% took direct action by installing a treatment system, 11% indicated they changed behavior by using a water pitcher, and 13% research treatment options but haven't yet taken action. So immediately you can see, really a direct kind of a response to the data source, if you will. And even as we speak, we're continually supporting current regional outreach meetings and the Seacoast Private Well Water Initiative, which is another targeted outreach program that's going on through the seacoast of New Hampshire. And I think final slide coming up. How am I doing for time? Okay, 2:24. All right, so just really to conclude, and we'll leave some time for questions. And if we don't have time, please feel free to reach out to me as well. But, so in terms of successes and take-home messages, prior to this dashboard, it was really difficult to access this information. So we did it, right? We have a version 1.0. It's not perfect, but I think it's a really good start. We're looking forward to future versions. But we have so we have an place for the first time you can go and look at this historical data. We're really hoping that this dashboard will provide town officials, policymakers, environmental health professionals, and private well users access to New Hampshire well water quality data. We really hope that it will improve understanding of high-risk areas in New Hampshire, as well as specifically with high probability of exposure coupled with high population on private wells and low water testing rates. We really hope that it will work in tandem with our colleagues in the Department of Environmental Services to continually encourage testing and treatment of private well water and ultimately reduce exposure to harmful contaminants. So with that being said, I think my next slide are it's just a thank you. So thank you for being here today. I can't see you. I don't know how many people are here or on, I guess 19 participants, is that right? But thank you for being here. If this is something that you're interested, please feel free to reach out to me. Again, we're not experts by any stretch of the imagination, but we have gone through this process once. So I'd be happy to share kind of best practices or things that we learned through the process. There are many states out there who have similar projects as well. And so there's some other resources as well, but please feel free to reach out to myself or Nick Shanka as well. I don't know if he's on the call. He said he might hop on, but please feel free to reach out to us as needed. So thank you. And I think we only have 4 minutes, 4 minutes of Q&A, but please feel free to ask any questions if people have any questions.
Great. Thank you, Sam. Appreciate you sharing your expertise with us. As mentioned earlier, just a reminder to the attendees, if you do have any questions, feel free to use the Q&A box. I think we got one question in the chat box, so I'll read that out. We've got Lance asking, will other analytes such as perchloroethylene or PFAS be reported?
Yeah, so great question. And that's been something that I think a lot of people are interested in, kind of having one dashboard that has everything on it. And as of right now, we're going to be continuing to focus on these natural contaminants, where our Department of Environmental Services will be really looking at kind of some of those human-made contaminants, and kind of controlling that message, if you will, directly through their agency. So our dashboard efforts currently will not be including, as far as I know, at least for version 2.0, increasing our contaminant range currently.
Right, thanks.
Mhm.
Another question coming from Brian. Are you aware of any potential electronic health record studies identifying high population, high exposure, and low testing areas, counties with disease rates from those communities?
I am not. And that, of course, is the ultimate goal, right? Is so. I mean, is to try to kind of make those connections, if you will. And obviously, that's a challenge in environmental health, and that's a lot of work to do so. But I don't know of any specific resources. I don't know if there's others on the call who might have an answer better than I do on that.
All right, any other questions, folks? We got 2 more minutes. And as you're thinking of additional questions, I just want to remind folks that we do have a webinar survey that will pop up as soon as you X out of this Zoom webinar. I'll also go ahead and drop it in the chat box because feedback is really important. Also, we're conducting our annual evaluation right now. So if you are interested in participating in that, I'll go ahead and share that link as well.
I'm not used to not seeing people.
All right, so both of those links are in the chat. And it looks like we don't have any additional questions, at least not in the chat box. I'm not seeing any in the Q&A either. Yeah. All right. I guess we're pretty much at the end of our time here, Sam. Thank you so much for sharing this presentation with us. Thank you for making time, and thank you to all the attendees for participating. Just as a reminder, we do have another panel session tomorrow featuring 2 speakers. We are having Judy Manners from Tennessee Department of Health and Rose Galbraith from New Mexico Department of Health, sharing some of their methodologies they've developed on estimating the number of private well users, and some risk estimations to contaminant exposure. So if you are interested, feel free to register and attend, and I'll see you then. Thank you so much. All right. Thanks, Sam. Thanks.
Okay. Thank you.
Take
Are we
care.
still recording?
Yes, it is.
All right.
Thank
All right.
you.
Well, thank you,
Appreciate your
Tariq.
time.
Thank you, Nicole.